Paper notes, they're used everywhere at UHP, on our wards and in our theatres. And all our paper notes live here at Bush Park. If you haven't been here before, it's quite a sight. The store holds around 800,000 paper records, and that is a lot of paper. Did you know that if all the notes from the main store were stacked on top of each other, they would be over 6 miles tall? That's taller than Mount Everest. Moving patient notes around the hospital safely and securely is run by the team from the Central Records Office. On an average day, they'll move around 2,000 notes and process at least 5 tons of notes back into the library every day, which weighs the same as an elephant. We're on a journey to transform how we work here at UHP by introducing an electronic patient record. An EPR will mean we no longer rely on paper for the collection of patient health information. It will bring all of this information from all specialities into one place and enable faster and more accurate decision making.
So one of the biggest transformational changes that we're going to have for our future of an EPR will be that we will reduce the need for paper to be in the organisation. So we will move away, and it will be a gradual process where we move completely away from having a clinical note. You will not need to be requesting notes for patients because all that information will be held within the electronic pathway. What the benefit means for patients and for our clinicians is that you're not having to wait for information to arrive. The information will be instantaneous, it will be there and it will be ready and it will be available for them. Paper records is an absolutely fascinating journey. So it starts off when you're very first born with one little paper document where we've in a folder, and that whole journey of your life, if you live in Plymouth and you stay in Plymouth, in your hospital bases always at Derriford, will be that journey of your life. And the way that moves around the organisation, it comes to be stored and then has to be moved back and forward to the organisation every time you come for an appointment is incredible. So the amount of carbon footprint, to be honest, that your paper record is going through at any one time is enormous. The impact from moving paper from one place to another is significant. So here's the notes. They finally made it to the actual hospital site, and they're being ready now to be prepped and given to whoever needs these particular notes to see their patients. And you can see the extent of the journey that those notes have gone through, and the amount of, again, carbon footprint that particular ride across from where we started at the Notes Distribution Centre to here at the organisation. So I think it's really hard to visualise the future of what an electronic patient record will give to us, and the power of what that record will have in it. And at the moment we're very reliant on multiple systems and the paper record, and it's trying to imagine a future where you won't need to wait for notes to arrive. You'll be able to have your appointment with your patient and they won't be lost. They'll be in a system that's achievable straight away, so we can access things at that point of contact. And it also means that if somebody comes in and a surprise visitor, maybe they've had a collapse, but they're a known patient to us, that actually we'd be able to retrieve their data and their information without having to find a paper record. So even if you've just got your name, we'd be able to start searching for your information and your personal record and be able to treat you as quickly and as beneficially as possible.